Nobody expects to have a child be injured or born with severe medical conditions.
It's not just a job. Everyone is here because they really care about the kids.
Ashley House is an advocate, and that's what they really are.
Our primary goal is to strengthen families.
It became, my home, and I had my own room and I set it up. And
I think Ashley House provides a tremendous amount of support to families during what is probably the most difficult time of their life.
I just didn't know where to turn. Ashley House was there for me. They were my family. They still are my family.
We care for the child as much as the family does.
I decided one day when I was up there to get a mirror and look at me and Josh in the mirror. And I got a really good response with Josh. And he looked right up at me, and so I decided to do that every time we went up there.
Josh was Shelley Conlon's son, a near-drowning victim who survived for more than 4 years. He lived at Ashley House.
I don't know what I would have done without Ashley House. My daughter wouldn't have had a mom. So it made my life easier. I was still able to be in Joshua's life every day. I was still very involved with Joshua, but I wasn't able to care for him at home.
Josh's doctor knew this home-like but technically advanced setting is where the best available care is to be found, where a team of highly trained and caring RNs, LPNs, CNAs, and social workers are trusted to work around the clock, improving the lives of medically fragile children and their families.
We provide high-tech, advanced care, but in a lot of ways we're also like a family. And that's why I like working here. We have enough staff to deliver high-quality patient care, but we also really get to know the kids and their families very well.
Children with many conditions are served at Ashley House, including chronic lung disease, bronchopulmonary dysplasia, short gut syndrome, traumatic brain injury, closed head injuries, spinal cord injuries, coma, chromosomal abnormalities, cancer, organ transplants, and seizures. Ashley House children are technology dependent, needing TPN or IV therapy, tracheostomy care, ventilator therapy, frequent respiratory therapy, oxygen therapy, cardiac care, pre- and post-organ transplant, and peritoneal dialysis. Steve Freeborn's medically fragile son died at 3, and that set Steve's life course. Now, the president of the board of directors, he carries on the mission started back in 1989 when it became clear that too many technology-dependent and medically fragile children were staying too long in hospitals, wound up in adult nursing homes, or were just shuttled out of state.
If a doctor had come to me and said, you have these problems, and they're going to be lifelong problems for as long as your child is around, but here is a source that can help you, and directed me to Ashley House, it would have been so much easier for us. If the child is not quite ready to go home, it gives the parents a chance to come in here in a kind of a home environment and learn how to work the machines that are going to help the care for the child.
Taking that sense of shock out of the emotional and technical challenges that come with a medically fragile child is a vital part of the program here. The solution is skilled care and excellent training for the parents.
Now you can put her nose back on.
There is one staff member for every 3 kids, and everybody gets training, like Gilbert here, learning to operate his state-of-the-art wheelchair so he can move toward a sense of greater independence and confidence.
No, that was a trick. You're not supposed to use your eye.
My favorite part of it is the teaching that we get to do with the families. We enjoy having the kids here, of course, but ideally the best place for them to be is at home with their families. And I love being able to help parents be more comfortable and feel more confident in taking care of their child and seeing that transformation from being scared and feeling awkward around all the equipment and all the alarms to becoming more and more comfortable and feeling that they can take their child home and they can be back with their family, because I think that's really the ideal situation for all of these kids.
When it comes to parental training, Deborah Evans is a success story. She remembers the fear and the sense of the unknown when she learned her son Nick would always need special care.
They gave me all the training that I needed to learn this care, and here we are. I never thought I could do it, but it's just second nature to me now.
Deborah Evans and Nick have been involved with Ashley House for 9 years. So yes, long-term care is available too, and so is respite care, when families just need a break.
Ashley House provides some limited long-term care, and we also provide some end-of-life care for children. But one of the things that we provide that is a really great support for families in the community is respite care, so that the child who can't go to the neighborhood babysitter with that tracheostomy and the nursing care that's needed can come to Ashley House, and the family can have a needed break together.
Over the years, more than 700 families and their children from all across the West and Alaska have been helped at one of Ashley House's 5 locations in the Puget Sound area: Kent, Enumclaw, Browns Point, North Shore, and Olympia. Ashley House is unique, providing clinically appropriate care, the best technology, and highly trained staff in family-friendly and inviting residential homes.
Well, Ashley House is a very home-like environment. It's not uncommon to smell brownies cooking or cookies, but at the same time to hear a ventilator in the background. Another thing I think is very important about Ashley House is the close relationship that we have with the physicians at Children's Hospital, Mary Bridge Hospital, that work as a team with our clinical team to provide the excellent care.
Preparation for life after Ashley House includes ongoing medical and equipment training for families, social work, help with insurance, and maintaining relationships with outside doctors and community support resources.
And for granulation tissue, she has a Toby that we put right down here.
Children who are able interact with the community, attend school, and go on outings.
We play, we go to the zoo, we'll go outside and play bubbles. I mean, anytime we can get the children out, it's great.
In a perfect world, there would be no Ashley House, no place needed for seriously hurt or sick children. But the world is far from perfect, and Ashley House is uniquely suited to meet the special needs of medically fragile children.